All right, so Doc, from your vantage point as the chair of the governor's uh, physicians board, where are we at in terms of containing this latest surge? And is there a light at the end of the tunnel for easing some restrictions?
Yeah, I think actually, Nestor, every day when we have our morning meetings with the governor, sort of you can see this looks that have gone from great concern to lots of smiles around as the data comes out and shows that our CAR score is now better than it was before Delta ever started. It's down below 4 today. The CAR score is 3.9. That the number of people in the ICU continues to slowly go down, a little bit up and down, but the trend is clearly better and better. In fact, at GRMC, if I recall from today and yesterday, there are no ICU COVID patients, which is, I mean, something we should be celebrating. The number of patients altogether in the hospital is lower. We do still have deaths, but now we're finding it's more, we're left with these small number of people who are still not vaccinated. We're way above 90%. And the ICU, as we've experienced before, is almost all unvaccinated. But I think people have been listening and we're still doing quite a bit, even though they're latecomers. We're happy to see people seeing the benefits of getting vaccinated. But to answer your question directly, the light is clearly there at the end of the tunnel. And I think it won't be too long. And actually, I feel very confident that if we see this trend staying without numbers bouncing back up for some reason, that the restrictions will be loosened shortly. Of course, the governor has the final say in that, but she is inclined herself to start to release the restrictions soon.
Yeah. When you say soon, obviously we've got Thanksgiving coming up this month, and then Christmas and New Year's, the holidays. A lot of people are looking forward to getting together, with families. Will there be an easing of restrictions before that time, and what will it look like?
I would say, so of course, because the governor hasn't given her final approval of exactly how we're going to lift it, I would say people can expect two things. One is that it will be gradual, right? We don't want to, we're fast on Guam. We can switch our on and off school, on and off, or restrictions on the number of people we can go out with pretty quickly. We don't like it. And so we'd rather sort of gradually increase it, do it for a few weeks, and then if that works good, further release restrictions. For example, you can expect that social gatherings, the number will go up. It's extremely unlikely that it's going to go up to 1,000, so that some of the giant weddings will still maybe be put off for a while. But for sure, the social gatherings is likely to go up. No, I can say pretty confidently. That's one thing that the governor wants, is to increase the amount of social gathering, because we're a social group on Guam, right? And then looking at the changes for the restaurants as well, to be able to get people to feel back to normal. I think those are the two highlighted areas, but lots of other things. The one thing, though, Nestor would emphasize is that we don't want to take, if you will, 3 steps forwards and then take 2 steps backwards, so that the mandates that do stay in place, we really need people to cooperate so that we don't have a bump. And also, myself and my colleagues are really hoping that people sort of learn that the new definition of fully vaccinated means that you got your you got your 3rd dose, your booster, 6 months after your last dose. I don't know any physician who hasn't done that. I think there are a couple maybe, but in my circle that I know of people, everybody wanted to get their booster because after the 2 doses, we know that after 6 months, we were so good at getting vaccinated on Guam that we had a large number of people after 6 months who needed to get the booster. Otherwise, they were going to get sick. They weren't going to get very sick, but the effect was wearing off. So I got my booster. Everyone else has gotten their booster because we were early endorsers, if you will, but we knew that our immunity was waning a little bit, such that we could get sick and be in the hospital, even if only a few days, but we could probably avoid that. Statistically, you could almost completely avoid it if you get your booster. It's not 100%, but nearly everybody who gets their 3rd or booster dose has been able to avoid being admitted to the hospital. So it's a combination of loosening restrictions while telling everybody, hey, when were you vaccinated? Add 6 months of that and come in and get vaccinated. Still free, still widely available at multiple places. On top of that is to get the kids vaccinated. If we can get the kids vaccinated, kids, thank God, they're not likely to die. They still can get sick. We have had a number of people in the hospital, number of kids in the hospital. The odds of that are low, but at least we feel that they're less likely to be more active spreaders. They can get it passively, but if they get very sick, they're probably spreading it. So that will, I think, give parents reassurance. It gives teachers reassurance, administrators, and helps with some of the vulnerable people in their family that we, even if you're vaccinated, we know that they still could get sick, and those who have not gotten their third dose, or even those with comorbid conditions, we don't want them to get exposed to COVID at all. So it would allow kids to feel safer and not worry, and have their parents not worry that they could be with grandma or grandpa, that the Menumco can enjoy being around kids again.
Yeah. And how important is the booster and the vaccinations for children 5 to 11 going to be in easing the restrictions? Is this really where the rubber meets the road, as they say?
Probably not, Nestor. I think what it really means is we just sort of, meaning as long as we're seeing a clear path towards not having our healthcare system at risk. On Guam, we've been doing great. Even with Delta, we've done okay. The real issue is we don't have a town next door to send people to if the hospitals get full. So as long as the hospital system is not in jeopardy, as long as what we've now sort of commonly called our fragile healthcare system of Guam, it's good, but it's fragile. If we get too many people in the hospital, that leaves others waiting too long. That was our big concern. I mean, bravo to the entire community in terms of, coming together and making sure that didn't happen. That's our main guide. Is if the hospitals are doing okay, we can start to reduce the restrictions. It's more of, it's not dependent upon people coming to get their third doses. It's not dependent upon all the kids getting vaccinated, but we're saying as a community, we have to do that. It's sort of a commitment that we're hoping that we as a community, as we did early on, all got vaccinated, or 90% of us so far, that we make that commitment to say at 6 months, come and get vaccinated, get your third dose. And that way you won't ever get admitted to the hospital. A promise? No, but a huge decrease in the likelihood you'll get admitted to the hospital if you get your third dose. And your doctors, we all trust these vaccines. You have 3 choices, and we all believe in the effect because we see it firsthand. So I think that if you haven't gotten it, it's time. The safetiness has been out long enough. You can feel safe getting your vaccine. If you've had 2, come and get your third, or if you did Johnson & Johnson, come and get your second, and take your children in to get vaccinated. It'll make you feel more comfortable. It'll be a safer environment around everywhere they go, including hopefully with Menumco and older kids.
Are you happy so far with the rate at which the boosters and the child vaccines are being taken up?
Yes and no. I'd say we're doing okay relative to other communities in terms of how fast. And I think that public health made the first order in the nation for the childhood vaccines. So we're going as fast as we can. I think there's still a little bit of difficulty in terms of getting that vaccine readily available for the kids everywhere. We know that if parents are working and kids are in schools, we need to make it truly available every place. We will. And also it came on so quickly that even though we did plan and go as fast as we could in terms of planning, we want to make it even easier for parents to get their vaccines. And then again, with the booster, again, a lot of people working all day, every day, so they haven't made time. So actually, after this conference call, I have another meeting with some public health officials to see if we can work with those who can only come in the evening or perhaps on Saturdays, making it easy for them as well. We don't want people to lose income for it. We don't want people to have to take off work. So we'll, as a community of providers, try to find a way to make it so it's easy. I would like to have 90% of people who got vaccinated, 90% of us got vaccinated. I'd like every one of them to get their third dose. So yeah, I'm always looking to get that last person in the circle of safety. So I'm happy. It's been pretty good, but we'll work hard as a community of providers. And we ask the community to try to find a way to come in and get your third dose, especially for those who have significant other illnesses, what we call comorbid conditions. If you're diabetic, if you have high blood pressure, if you have other conditions that require you to be on chronic medications, it's likely that there's a high likelihood that this will be a big benefit to you, the third dose, that is.
Yeah, there seems to be a certain small percentage that do not want to be vaccinated and will not be vaccinated even at this point in the game. What do you say to them?
Well, I would say, I think it's important for people. I see sometimes on blogs and comments that people think that we are discriminating against the not unvaccinated and purposely setting them aside as a second-class citizens and like. And I think nothing could be further from the truth for the leadership in Guam that I've seen on both the healthcare and administrative side. We care about the unvaccinated, and all you got to do is go to the hospital and see how much care is there and is provided. Nobody discriminates against people who smoke. We advise them strongly not to do so. We limit where they can smoke so that to reduce the potential harm to others. But the reality is we don't want people to smoke. I don't want people to get lung cancer, but it doesn't mean that I care any less about those people. And whether it's my own relatives, shoot, I have a brother who won't quit smoking. Of course, I still care about him just as much as everyone else. And the same is true for the unvaccinated. I advise people to get vaccinated. I'm happy to talk to them about why I think it's important. But if they don't want to get vaccinated, they do need to understand that we may place some restrictions, just like we do on non-smokers, because we don't want to overwhelm our hospital system. We want to keep people from getting COVID who are unvaccinated, but it's not because we don't care about them. It's actually the opposite. We care just as, I shouldn't say the opposite, we care just as much about those people. So it's not a divide and discriminate kind of thing. It's saying we ask you to come together and help the community. I do feel there's a certain responsibility to quit smoking, and I do feel there's a certain responsibility to get vaccinated, but it's not going to change how we feel about those people. I just say the science is pretty darn clear that it will reduce your risk of becoming seriously ill versus the potential risk. And no one has said that any vaccine is not without risk. All of them are. I get a flu vaccine every year, and I've actually gotten sick when I got a flu vaccine, but I come back the next year and say, I hope that doesn't happen again. And I get the flu vaccine anyway, because it's worth it to avoid getting seriously ill. I got a minor illness when I got the vaccine, but that's what we're saying is what would happen here. Your risks are very low. The benefit is huge in that there's an extremely high likelihood it will prevent you from dying from COVID. To me, it seems rather clear, but I understand that that's only the advice I can give as a doctor. It's not my choice to tell a patient what to do. It's my obligation to advise patients what to do. Yeah.
A few weeks ago, we had this new development with regard to DOAs, and then the CDC apparently came in. Have you heard from them, and have they had a chance to look into that, and what might have been the cause of it?
Well, we do have some experts here, and we do seem to have I don't think we're having it now, but we seem to have a much higher rate of dead on arrivals due to COVID than other places. So it was a good idea to have the CDC come out. I can tell you that, no, first of all, they have not come and given us their data. So I suppose I should wait until, because I don't actually have any data. It's not a secret. Those guys work kind of slowly, right? They're looking at mathematical projections and trying to figure out why these people came in. But a lot of them, at least I should say a fair number, their relatives said that the person was getting very sick at home, and some even were scared to come to the hospital because they thought there was COVID at the hospital, when in fact they actually had COVID, but they went undiagnosed. So they had COVID at home, and then they died at home with COVID, but wouldn't come to the hospital because they were scared they were going to get COVID, which is a sad set of circumstances. We've been trying to help people understand that around this time, you got to come in if you feel sick at all, little short of breath, cough, congestion, come and get tested. I might add, Nestor, that that's one of the important things as we move towards opening things up. Right now, we're at less than 6% or around 6% positivity rate, meaning that if 100 people come in, on average, 6 of them are showing up as positive. That's like twice as good as we were before. We were at 13, 14%. Now we're twice as good, or cut it in half, I should say. So keeping up testing on a frequent basis, particularly if you've been exposed to anybody, particularly if you start to feel ill and are in an environment where you potentially expose others. What's important about that is that we have treatments now, so that if you're positive, we can get treated right away. And that is so critical. We've had, I think, close to 800 people now who got treated with, I think, 2 ended up getting sick. The rest got better very quickly. 2 ended up with hospitalizations, but that's a great rate out of almost 800 people only who were, all had symptoms, and only, or virtually all, and only 2 ended up in the hospital. So we're telling people, I'll tell you right now, if I got COVID and I was even the slightest bit, well, I would do it because I'm in a healthcare environment. But if I wasn't and I got COVID and had the slightest symptoms, I would get treatment right away. So as to avoid, you get better faster, you avoid hospitalizations, and you're less likely to spread it. At least that's what we think. The main thing is to get vaccinated, but if you're not yet on your 3rd dose and you get COVID, this is the way to avoid getting hospitalized.
All right, Doc, before we let you go, obviously we're all waiting to hear from the governor on when she might make that decision to kind of ease restrictions, especially heading into the holiday season. Any final words on that?
Yeah, and I'd say is to please follow the governor's directions very closely, meaning if she says it's 50, don't make it 51. Just make it 50. Stick with the mandate so that we could all move forward together as an island, while remembering to get tested if you feel sick. Please get your 3rd dose and have your loved ones, particularly those who have other medical conditions, get tested as well. And if you haven't been vaccinated, to make a real sincere rethink of whether that's wise in what we've seen through the Delta, which is that only the unvaccinated have ended up in the intensive care unit. And talk about it with your doctor, knowing that with perhaps rare exceptions, there aren't healthcare workers who are judging you for your decision. We just want to give you the best advice we can, and we're available to help you make what is, we think, the best decision, which is to get vaccinated. And don't forget to get your kids vaccinated as soon as you can. Thank you, Nestor.
All right, Dr. Nate Berg, chairman of the governor's Physicians Advisory Group. Thanks for joining us. Appreciate your time.
Thank you.